Hey, I'm Will Martin. Let's talk about the first topic of conversation here today, and that is why urgent care centers are popping up everywhere. Now, I know in some parts of the country, urgent care centers have been around for a long time. In great numbers. I remember being down in the Dallas-Fort Worth area back 10 or 15 years ago. Even then, there was, an urgent care center on almost every street corner. But up here in New York, it was certainly less prevalent. And my second job as a nurse practitioner was working in an urgent care center. But urgent care then was very different from what it is today. And we'll talk about that in a little bit. So, according to statistics from the Urgent Care Association, 11,500 urgent care centers have opened up since 2019. And it's growing at an estimated 7% per year rate. And that's not including the retail clinics, too, the minute clinics and the clinics that are inside the pharmacies. So there's just a huge number of urgent care centers popping up everywhere. Urgent care centers around me have become owned by one company, and they do very basic things. They really don't do a lot in the way of diagnostic work. They'll do some x-rays if they have an x-ray tech available, but my understanding is they're really having a hard time recruiting x-ray techs to work in the urgent care centers. So if you go to one near me, you might not even be able to get an x-ray done. You might be able to get a small cut sutured. You might get a prescription for, maybe antibiotics if you needed it or something, but that might be it. Otherwise, you're going to be sent to an emergency department, and that happens all the time. But, to talk about the purpose of urgent care centers are designed to treat, obviously, non-emergency type conditions. It's always been recommended that you go to an urgent care if you can't get in to see your primary doctor. In a perfect setting, for any unexpected illness, you would go to your primary doctor. But let's face it, in this day and age, that's just not possible. And I think we all know that if we wanted to see our primary doctor today, chances are pretty slim that we would be able to get an appointment anytime within the next month. So that's just the way that it's working out today. So urgent care centers are often staffed by nurse practitioners and physician assistants. Now, in 2009, it was said by the Urgent Care Association that 70% of urgent cares were staffed by physicians, but that number is down to less than 16% today. Urgent cares have the benefit of being open late and oftentimes open earlier than your primary care doctor, and that's also the case where they're often open on weekends, too, when your primary doctor isn't. So urgent care use has grown because of those reasons and also because of, I think, some major gaps in the primary care system. We know that primary care, not only is it difficult to get an appointment in primary care, but there's less people practicing primary care today. Even nurse practitioners, and when I became a nurse practitioner, the purpose was to be a primary care provider. However, fact is, few, if any, went into primary care for any length of time. I mean, we were all encouraged to do that, but very few did. We went into some subspecialty. I went into emergency medicine. Actually, I did intensive care for 2 years and then went into emergency medicine. But an issue with ER versus urgent care is that ED visits obviously cost more. If you have insurance and you're paying out of pocket for a large deductible, you're going to go to an urgent care center if you possibly can because it's going to be a cost savings. Also, if you just have a copay, your copay is probably going to be a lot less going to an urgent care center. So the growth of urgent care really highlights the problem going on in primary care today. And it's estimated by the Association of American Medical Colleges that there's going to be a shortage of 55,000 physicians in primary care in the next 10 years. And if that number really bores out to be true, I mean, that's devastating for primary care, figuring that there will be less people around in 10 years practicing primary care than there are right now. So I don't know how primary care is going to continue to exist, especially when you don't have the PAs and the NPs entering into primary care in the way that it was designed. So, are there downsides to going to an urgent care? Well, some doctors are obviously concerned about fragmentation of healthcare, that it might weaken relationships between doctors and patients. And the only counter argument that I have to that is I think in most cases, when you go to your doctor's office, you may not see the same person each time anyway. You're going to see a different person in the office more often than not. I see my primary doctor every 6 months. He knows me, but he knows me mainly because he knows what I do for a living. And so there's that connection. But beyond that, I mean, he sees, what's he see, 40, 45 people a day. I don't know how you keep track of everybody anyway, if you're seeing that large number. Other questions about urgent care that physicians and other trade industry groups have is the quality of care at urgent care. Now, the CDC is critical of urgent care, saying that urgent cares typically prescribe more antibiotics than necessary. And that may or may not be true. I can say that when I started practice in urgent care, which was in 2000 something, it was 1998 when I started in urgent care, you were expected to write a prescription for an antibiotic. I don't care what anybody says, but in 1998, there were two things that you were expected to do. You were expected to give pain medication, and you were expected to prescribe antibiotics. That wasn't right then, and it's taken a long time, but I think patients and the public have come to realize that judicious use of not only antibiotics but pain medication is the right thing to do. So we've all gotten on the same page, finally, when it comes to that. So again, why have urgent cares become so popular? Well, obviously, as we've said, longer hours, they're open on weekends, and it's just about impossible to get an appointment with your primary doctor within a month in most cases. So the urgent care industry has said that 80% of the U.S. population is within a 10-minute drive to an urgent care center. Now, urgent care centers typically will build in a more populated area, and that's another criticism of urgent care, that they're not serving the rural areas and that they're only open in the large suburban and urban areas. But urgent care is a volume-driven practice. There's not a lot of profit to be made on each individual visit to an urgent care, but large volumes are what make the money, and that's how urgent care survive. I would think that in a rural setting, it's more appropriate that the primary care doctor be the primary provider in a rural setting, because you really do get to know your patients out in a rural area. So in regards to volume, urgent care centers are seeing hundreds of patients each day. I've had discussions with PAs and nurse practitioners working in urgent care centers near me, and they are stretched thin. As a matter of fact, their turnover rate is fairly high because they go there and they're seeing 7, 8 patients, 10 patients an hour. And I think that's beyond anyone's capacity. Even if it's minor stuff, even if you're just seeing people for coughs and colds, the worry is that you're going to miss that one cough or cold that's actually something more serious, like a pulmonary embolism or pneumonia or something like that. So it's not the panacea as a provider that one might think. You're seeing lesser acuity patients, but within those lesser acuity patients, there's always that landmine, that one patient that probably needs to be in the emergency department, but shows up at your door instead. And that's the big fear of working in an urgent care center. You're going to get very used to seeing a lot of people that are not very sick, and then someone is going to cross your door that really needs to be in the emergency department now. And so in that case, and in that sense, my hat's off to urgent care providers, because you do have a tough job. You're there to screen people essentially for severe illness, while at the same time treating their minor illness, and also at the same time keeping the train moving and keeping people moving in and out of there quickly, because again, wait times are critical no matter where you go, and nobody wants to wait for anything anymore. So, and I don't blame them. I don't like to wait either. The next thing we want to talk about are the fake diplomas that were found in Florida. Apparently, 7,600 fraudulent diplomas, nursing diplomas, are out there across the United States. Fake diplomas and transcripts also were sent to 7,600 people across the country who had been recruited to attend apparently some online nursing programs. Now, apparently, a lot of these people were already experienced as LPNs or nursing assistants and wanted to get their RN, and obviously wanted to do it in a way that might be a little bit quicker and result in less coursework. Problem is, they went through the programs, they paid their money, they got their transcript and diploma, and then they wound up finding out that it was all fraudulent. Interestingly enough, though, about 2,400 of those 7,600 people took the nursing licensing exam, the NCLEX exam, and passed it. So that's a pass rate of around 32%, which sounds low, but in comparison, in 2021, the NCLEX pass rate nationwide was 82% for those that went to a legitimate nursing school. For those that had failed the first time and took it the second time, their pass rate was 45%. Not a whole lot higher than the 32% for the fake nurses. So be careful if you're thinking about going to school. It doesn't matter what you're going to school for. Make sure that it's an accredited institution before you put your money down. And finally, I'm going to just say this about the mask mandate. New York State is finally going to lift the state mandate for wearing masks in healthcare settings. However, many counties in New York, probably most counties in New York, have already weighed in on this and have said that they're going to continue with mask mandates for the foreseeable future in healthcare settings where you are actually forward-facing with patients. So the thing that bothers me is that there is a lot of evidence out there suggesting that masks have done little or nothing to prevent infection, prevent transmission. And I think that a Cochrane review that was recently published supports that. And I'm going to find that and talk about that because I think that's worth talking about. My issue with masks, besides them being uncomfortable, is, well, one issue that I can't support with any evidence, but I think any reasonable thinking person would understand that if you are wearing a melt-blown plastic mask, which is what the procedure masks are, and you wear that for more than its intended period of use, which would typically be a procedure, 15 minutes or so, what you're doing is you're loosening and fraying the inside part of that mask, which is polypropylene, plastic, and nanoparticulates can be loosened, released, and inhaled by the wearer, one would think. I don't have any evidence to support that. There's very little evidence out there. There is a Chinese study that came out right at the beginning of the pandemic that suggested that that would be a problem, but that study has been buried. I do have a copy of it, and I think that's another thing that we probably should be talking about. But I think that these things are at least worth having the discussion. We've gone past the vaccine, but now we're still dealing with the mask and whether the mask is effective or not. And I understand there's a lot of people that are just very scared about getting sick. Maybe they're immunocompromised. Maybe they're just germaphobes, whatever it may be. If they want to wear a mask, they certainly can. And the theory was that you're wearing a mask to protect yourself, not to protect me. Me personally, my biggest issue is I want the patient to be able to see my face, and I want to be able to see the patient's face. And I find it really difficult to communicate with people when I can't see their facial expressions and they can't see mine. I have patients that I've been taking care of, not in the emergency department, but in the wound clinic for the past 2 years that haven't really seen what I look like. And it's not therapeutic. It's not correct. And if it's not providing a definite, provable benefit then why are we doing it? That's what I'd like to see studied in a good, randomized, controlled trial setting. Whether masks have done any good. Not that we're going to change a whole lot right now, but for the future. I think we need to answer that question. I'll leave it at that for now, and I'll talk to y'all soon. Thanks. Bye.